What are the numbers you're seeing for, the younger kids to be able to get vaccinated because they would have, needed to start their series right before Thanksgiving to be fully vaccinated for Christmas?
That's such an important point. We're not where we would like to be. And in getting out into the community and speaking with parents and PTAs, parent teacher associations in our schools, people are fearful. I mean, it's natural, I think, to be afraid of the unknown. And I think the more that we can educate our parents, our guardians, the more we can do with regard to increasing our vaccination rate for children. I think a lot of folks, because of the EUA, the emergency use authorization, which was so necessary from the FDA to get this vaccine out there to our population, I think people are a little bit fearful about that. And they're like, Dr. Santucci, I just want a little bit more time. I just want to know a little bit more. And you know what? Sometimes with a virus like this one, you don't have that much more time, particularly in the winter months, particularly around the holidays, where I can share with you that there have been, I believe it's about 8,500 hospital admissions in children in the United States related to COVID-19 since this pandemic began. There have been 100 deaths secondary to COVID-19 in children in the United States since the pandemic began. And there are things like MIS-C, which is the multisystem inflammatory disease that we're seeing in children. I can tell you that at Yale New Haven Children's Hospital right now, our children's hospital, part of our health system, there are children with this disorder who are struggling and being expertly treated by our doctors and nurses at the children's hospital.